Hello friends, welcome to Srinetralay. In this video, we will see a case of grade 2 phaco. I am entering with 2.6 mm main incision and the side port is 23 gauge as usual. This is a very soft case, not very hard, and the demonstration is for someone who is doing it regularly and for a routine case. There are no challenges in this case as per to start with. Staining with trypan blue is performed and we should give at least a time of 30 seconds to have good stain. Anterior chamber is filled up with viscoelastic. 5.5 mm rhexis marker is used to have guide for a good central rhexis. This gives us idea for the movement of our right hand and we can create a perfect rhexis in almost all cases. Staining also helps in controlling the rhexis size, specifically in pseudoexfoliations, in pediatric cataract, in younger patient we must do stain, and mature cataracts too. Hydro is performed and we can see it is well done and the wave of hydro is seen from posterior capsule also. Again anterior chamber is filled up and I am entering with a dialer. Right hand goes in and first the debulking cortical material should be taken out so that we will have more space for manipulations and to remove this grade 2 to 3 cataract. The first chop is very important. Here the technique is very simple. Hold, tilt and chop. I am holding the nucleus well in position, tilting it slightly because I have more space in the bag. The equator is very easily visible and I am using a horizontal chop technique to lift it up and chop it. The first chop is taken, the second chop again is done, and with no time the first piece is over and second piece is also getting over with phaco emulsification. This is not a very hard cataract. Cortical plate is also taken out with the phaco probe itself, as later on with IA it will become difficult to take that much amount of cortical material. Now the remaining bag is cleaned up with irrigation aspiration port. I usually use coaxial irrigation aspiration. That is very helpful and it takes out the material within seconds. You can see I have catched the PC in between but not moved my hand there, so it doesn't cause any difference. I have already showed this. If you catch the PC there is no harm, you should not pull it. Anterior chamber is formed again and here goes the implantation of a single piece foldable IOL in the bag. This is almost an unedited video. I want to show you that follow these steps very carefully and you can perform your phaco without hustle and repeat the same steps always for almost all cases. So you have a control over each step. Visco is washed off. Even behind the IOL the visco can be washed up very easily and thereby we complete the case. Anterior chamber is formed with saline and the stability of the wound is checked. Thank you for watching. Good day.